Let me summarize real quickly. This over 1,000 page bill represents a federal takeover of healthcare, 1/6 of our economy. Let me just summarize quickly the real concerns. First, and we've talked about this, 114 million Americans will have to move from their current plan to the government-run plan under this legislation. 818 billion in new taxes under this new legislation. 1.28 trillion in new federal spending under this legislation. 33 entitlement programs this bill creates, expands, or extends. 53 additional offices, bureaus, commissions, programs, and bureaucracies that will frankly get between you and your family and the doctor. Government in your way, government making decisions about your health care. What we need, the right approach, and this is what I've heard from you and from others across the 4th District in letters and phone calls and emails and faxes. What we need is to make sure we have the reform that makes sense and to take the time to do it right. Step 1, root out the waste and the fraud and the abuse that's in our current systems, already run by the government. Make sure we can improve Medicare and Medicaid and the waste that's currently in those systems. Reform, do the reform that will limit the amount of lawsuits. That will save everyone money and improve the cost and frankly the effectiveness of health care. Give the same tax break to families who have to go out and shop on the market and find insurance that meets their family's needs. Give the same tax break to them that we currently give to employers who provide insurance to their employees. And first and foremost, respect this idea that Americans want choice. Americans want to be in control of their health care decisions. They don't want more bureaucracy, more commissions, more ombudsmen, more federal bureaucrats making decisions about their health care, getting in the way of them and their family and their doctor, you and your family and your doctor making those decisions on your own. We're getting ready to head out for the August break. One of the things I look forward to is visiting with you more, learning more about what you think makes sense, what you think will do the right thing when it comes to reforming and improving our health care, so we can get this thing right. We can get this thing right when we come back this fall and are back in session.